Oregon.
Mr. President, a few minutes ago, I got off the phone with Jasmine Toole, who's an Oregonian living with an inoperable brain tumor. And as the shutdown lingers on, I want to share her story because she has been bearing the unthinkable consequences of her illness. And I'm going to start today, Mr. President, by asking, how can a country as rich and good and strong as the United States of America let Jasmine Toole suffer this way? She is a 30-year-old mother of 2 young children. She lives in Lake County, a rural community in south central Oregon. She's a public servant, an employee of the U.S. Fish and Wildlife Service. She has been living with an inoperable brain tumor. The cancer has caused related debilitating conditions. She is just in and out of hospital emergency rooms. Her digestive system is impaired. With the invaluable care provided by a home health worker, she takes in liquids and nutritional infusions through tubing that is plugged in to her abdomen. Because she lives in a rural area, her treatment can require long-distance travel. That's hard to deal with when you're suffering from the flu. Just imagine, Mr. President, and those paying attention to this, how hard it is with a brain tumor, a broken digestive tract, and feeding tubes attached to your body that prevent you from eating or drinking normally. She is confronting this health challenge with remarkable bravery. And I don't believe there is a single member of the United States Senate who would wish Jasmine's struggle on their very worst enemy. And then comes the government shutdown. Jasmine was due to travel to Nevada this month for treatment related to her tumor. But last week, as she was prepared to go, she was informed that her health insurance had lapsed. Initially, she thought it might be, we all know with insurance, kind of a recent hiccup, a recent problem, something that could be corrected quickly. This week she learned it lapsed in October, months ago, and her insurance company told her that only her employer could fix it. Jasmine's employer is shut down. Nobody is answering the phones. Right now, Jasmine Toole is suffering, this mother of 2, and is unable to determine what caused the lapse in her coverage or what can be done to get it fixed. The most immediate threat is this. Jasmine was told that her home health assistant cannot continue to help her if she doesn't have insurance. That means that within days, this 30-year-old mom won't be able to get the infusions she needs to stay alive. Now, if that isn't enough, Jasmine has been failed by the government on multiple occasions. Shortly after she went on medical leave in early 2017, she began the process of applying for disability retirement. She worked with the appropriate human resources official to prepare the paperwork to send to the Office of Personnel Management. She thought, as anybody would, that the process was underway and she would hear back soon about the results of her application. She just learned recently that the official who prepared the documents retired without sending them in. For a year and a half, while Jasmine fought cancer and was just hoping to get some positive news, her disability paperwork sat in an unused office, just sat there collecting dust. She had to travel to that office against her doctor's orders to finalize the paperwork once more and prevent a loss of benefits. But the Office of Personnel Management, that shut down too. Jasmine hasn't been able to learn where her benefits stand. Mr. President, it is too cruel already that thousands and thousands of Americans, our workers, are going without paychecks, that this shutdown is making victims of those who do public service. But consider what it's doing to this young mother of two, a woman who is currently fighting for her life right now. Because of the shutdown, she can't figure out how to restore her health insurance. She can't get the status of her disability application. She could be cut off, and I just talked to her, from her nutritional supplements in a matter of days. Mr. President, that means Jasmine could starve. That's what she just told me. So I say, Mr. President, and I've been talking to people who've suffered from health challenges for a long time. I was director of the Great Panthers for about 7 years at home. I listened to Jasmine, and I just said, how can it be that there is no outbreak of conscience here? No outbreak of conscience here in this Senate. How can a country as rich and powerful as ours fail Jasmine in such a shameful way? Our country is going to spend $3.5 trillion on health care. $3.5 trillion on health care this year. It is not a lack of money that's causing this nightmare for Jasmine Toole in rural Oregon. With the government reopened, things would be different. Things would be very different for Jasmine. There would be somebody on the other end of the phone line to tell Jasmine what happened to her insurance. And because of the professionalism of those in these positions, I think they could tell her how to renew that insurance. There'd be somebody to tell her what's happening with her disability application. Jasmine could bring back her home health aid and get the infusions she needs to survive. So I'm asking the Senate, how can this be allowed to continue? How can this be allowed to continue? The Senate passed a bipartisan government funding bill by voice vote just 2 weeks ago in the previous Congress. I see Senator Collins, who's had a long-standing interest in these health care issues. Senator Sass, also, who I know from our conversations, has a heart and cares about, people. The House passed this legislation. The pathway out of this shutdown is right in front of us. If the majority leader will decide when to bring the legislation up again, and we could do it tonight, Jasmine Toole could get that life-saving health care that she needs based on our conversation by week's end, so she won't starve. Mr. President, otherwise, unless the majority leader calls it up, seems to me the White House has no plan to end the shutdown. So I just think it's got to end right here in the United States Senate, where all of us say this cannot go on any longer. I just spoke to a young mom in rural Oregon who's in a fight for her life, a fight for her survival. Mr. President and colleagues who are here, I'm sure Jasmine is not the only such case in America. Jasmine Toole, and my guess is there are plenty of others in communities across the country. Jasmine Toole does not have the luxury of time. I'm going to go back to my office, my staff here, my staff folks in Oregon. We are just going to be pulling out all the stops now, because it really is a matter of hours to get Jasmine the help she needs. We do it recognizing there is only one immediate solution. The shutdown must end, and it must end now. I yield the floor.